Another day, another coronavirus death toll record. Nearly 4,000 American lives were lost yesterday. That is the highest single day recorded in the U.S. since the pandemic first came to our shores. And the CDC warns we could exceed 430,000 total deaths by the end of the month. Meanwhile, the more contagious virus strain that was first discovered in the UK continues to spread here in the U.S. Georgia is now reporting a case, making it the fifth state to identify the variant. It joins California, Colorado, Florida, and New York. For more, let's bring in Dr. Leo Nissola. He's a medical expert, immunotherapy scientist, and an advisor for COVID Act Now, a nonprofit that provides data on the pandemic in the U.S. So, Doctor, all eyes were on the Capitol yesterday as a pro-Trump mob attacked American democracy. There were very few masks being worn. And I know, as I was watching the news break down yesterday, that there were some members of Congress who were absolutely worried because they were all herded and evacuated into some rooms with their colleagues, and many of their colleagues were not wearing masks. So there is some fear from lawmakers that there was a super spreader event, that played out yesterday. And we also know that a third lawmaker just tested positive for COVID-19. So are you concerned for those members of Congress and members of the Senate who may have been infected yesterday because of what we saw happen?
Thank you for having me. I watched yesterday perplexed, and I wonder if those people forgot that we are living through a pandemic where we have lost in the past year over 3,000 healthcare workers to this virus. Healthcare workers that are working night and day to prevent our healthcare system from overloading. And it is already at a breaking point. So it was very heartbreaking and very hard to watch. Tanya Rivero doing the reporting yesterday, and I was truly appalled for what I saw. There's a lot of things to be said about what happened yesterday, and one of them is if folks that participated in that attack yesterday should quarantine, should get tested, and I would advise airline companies to not allow them to travel, because this will impose risks to everyone that would be boarding in those flights and to the air travel workers as well.
Doctor, that is a great point, because people came from all over the United States to participate in this. And I know that there are going to be people out there that are going to compare what they saw yesterday to the protests that we saw during the summertime. Vlad, but you remember when we would talk about those protests, one of the things that you would always say to me, particularly in New York, is how remarkable it is that so many people who were participating in the protests in the summertime, Black Lives Matter, they were wearing masks. This protest, I hardly saw anyone wearing a mask. It just, it boggles the mind. But I want to ask you, Doctor, the Trump administration announced some new efforts to give out vaccines at pharmacies, and this is particularly for high-risk groups, elderly people. At the same time, Health and Human Services Secretary Alex Azar is now telling states that they do not have to stick to the rollout plan, and they can work to get as many people inoculated as possible. There's a lot of back and forth about this issue, and part of it is, maybe states know their population better, and so they may be able to develop a rollout plan that is more specific to the needs of the people who live in those states. But others have said, no, you need a federal plan, because what we're attempting to do here is something that this country has never attempted to do before: inoculate as many people as possible. What's your take on it? Do we need a clearer federal plan?
We do. You're 100% right. It's heartbreaking to see that we have asked people to stay at home since back March 2020. We've asked drug makers to develop and deliver those safe and effective vaccines, and everyone did their part, but the federal administration has not held their end of the bargain. We have yet to see a federal vaccination plan, and in that way, we also have not seen a federal vaccination campaign. Vaccine hesitancy is still there. But for those who are willing to take the vaccine, people still don't know when to get the vaccine, where to get it, and how. So my hope, and my only hope at this point, is that the new administration that will take office later in this month is that they will put up a digital vaccination platform that allows for clarity, that allows for transparency, and also that guides states and how to deliver those vaccines. What we are trying to do this time has never been done before. So it's very important that the federal administration works with the states hand in hand by guiding them who should be getting these vaccines first and how and where. So I have not seen that through the course of the year. And I think the virus is gaining momentum. As you've seen, the new variants that are more infectious, the new variants are the one that was first discovered in South Africa also imposes a greater challenge to younger populations, which worries us a little bit more. So for me, my concern is that we are very far behind our schedule. And my guidance would be that for the first 100 days of the Biden administration, they should inoculate 1 million people a day. And that's a very ambitious project. So I hope that we can get to that better place later in the next coming months.
Dr. Leo Nissola, thank you so much for joining us.
Thanks for having me.